Hello, welcome to this week's episode of Heels in the Hierarchy. If you remember, last episode was on endometriosis doesn't wait, and that was on SJ's experience. But before that, this week we are going to be looking at women's health strategy. Please download, share, follow, and let anybody else that's in your life that would be impacted or find interesting, please go and let them know about the podcast. So today we're going to be talking about the women's health strategy. Hot off the press this week. 9 years, that's how long it takes on average for a woman in the UK to be diagnosed with endometriosis. But imagine that when you're trying to build a career in that time. So the government says that women's voices are finally at the heart of healthcare.
And we're asking today, what does this actually mean for women trying to build careers while their health is ignored? And this is one of the reasons we wanted to delay this episode, was to wait for the landing of this report. So what's happened so far?
Well, what's quite interesting, I think, is that it's not a new strategy, it's a refresh. So although it's like the language around the women's health strategy, it's a new health strategy, it's actually a refreshed women's health strategy, which is launched today. It's patient feedback. It's all linked to funding, which is interesting, and the promise of actual better routing and better pain standards.
If women aren't listened to, they lose money.
Which kind of sounds obvious, but this is actually quite new.
So we're not really starting from a good place, because it is new, but it's not really going to change much. Is that what we're saying?
Yeah, if you for our viewers and listeners, if you want to re-listen to the episode previously where we talked about stats as well as experience of endometriosis and how people talk and how people in the professional field is, it's still a horrendous stat to look at when you're thinking that although the original strategy was at 2022 and they've refreshed it now, the waiting time's gone up. So it's about 500,000 people still waiting for gynaecology. 50% are still not seen within 18 weeks. 18 weeks is a long time. It doesn't sound a long time, but that's over half a year? Something like that?
26 is half a year.
Okay, we're just under.
5 months?
Just to be able to even have a conversation. That's not treatment.
4.5, 5 months. Yeah.
And you think before even that, they've had you've got to think that's just the start of it. And then you've got 9 years on average for a woman to even be diagnosed. That's not necessarily in terms of preventing pain. That we're not talking about really supporting it. That's just around the stats around being diagnosed.
It takes up to 18 weeks to be seen, not up to 18 weeks to be fixed. Because after you've waited among the other 500,000 people to be seen, you have to be seen again and again and again for over 9 years. So this isn't just a waiting list. This is missing work. It's being labelled as being unreliable for missing work, managing your pain quietly, possibly going through performance management, all sorts of issues.
Yeah. Well, that's the reality, isn't it? Is that it can be I suppose the narrative can be, isn't it great that we've got a strategy and isn't it good that we've got all this? But for the reality is for women in work, in leadership, juggling lives, it means nothing unless action is actually seen.
Yeah.
So it's great that, we'll talk a little bit more about it, but my initial thought was, what's the accountability? How does that look in practice? If we already outside of women's health have to really struggle to go into to get even a GP appointment, and they're talking about women's hubs in this strategy, then is this just another signposting exercise where you're signposted to then be signposted to then be signposted?
Yeah.
But at the same time, they can, tick that box to say, well, isn't it great that women are being seen? For me, as a sufferer, because it's not curable, being seen is one thing, but being listened to is something else.
I was going to mention that, because a key thing here is that we've got the challenge of having endometriosis recognised and treated. we've got gender issues wrapped up in this, because it is evident that women are being treated differently when they are presenting with pain and with conditions that are challenging to be diagnosed. We also have an increase in mental health challenges in the 21st century. And if you are having to wait for 9.5 years for people to actually give you a diagnosis, that is not good for your mental health. So this is not one issue. This is a multitude of interconnected issues and impact. This is about being heard in your healthcare and being impacted in your career, because the career damage is potentially running parallel to the health problem.
But I think this is the confusion, isn't it, with anything, is, even from when I was sharing from the previous episode, it's very much around you're struggling in silence. You've been silent so many times. You've been gaslit. You've been able to, you kind of lose trust in healthcare professionals. And then this new health strategy of improvement is around being seen quicker. And it's been linked to funding and people's feedback to prove that they're being listened to. But if you've been going through that system, you don't necessarily trust the professionals making these decisions when they're predominantly a mix of people who don't struggle and suffer with this.
Yeah.
And so actually, I'm really just going, how much input was it from people who understand the impact? So I've seen loads of interviews and I've been really encouraged by people's stories. But I feel I'll be a bit more encouraged when I start seeing workplaces being very much like we've talked about. We'll put a post in the link around the menopause episode that we did, when we encourage people to take on the menopause friendly employer strategy, and people celebrating that we want to keep women in work. This is exactly the same thing. If we're talking about, we talk about mental health and the impact of that, and you think the consistency of being told it's normal, it's all the language that you're constantly having to fight. It's exhausting, isn't it?
Yeah.
And if we're thinking of what would really shift that, if employers and people in the workplace who are leaders could not only just know about this strategy, know the impact, but also know their staff of who's impacted, and they start changing that narrative of wanting to be an endometriosis friendly employer, how hopeful that would be in terms of morale for women in the workplace. I think that would be a massive trendsetter, I think. If people within the NHS, or people within the different sectors, the business sectors, were owning some of this, and just as much as they've started with the menopause, which is great, but again, that's just a starting point, isn't it?
I mean, it's clear that women are performing through pain.
Yeah.
I think there is an element of masking that inevitably happens. We know that if women feel undiagnosed, as we've said, it affects their mental health, but then it also affects their confidence to actually raise these issues at work. Because what can you say to your employer? You can't say, I've got X condition and therefore this is how it's going to affect me and how you support me.
Well, interestingly,
because if it hasn't been diagnosed,
if you're still on the waiting list,
if you're still on the waiting list, what can you say that is behind what's struggled?
Yeah.
Sorry, so you were saying...
No, you just triggered a point, just to remind our listeners that there has been a petition this week as well around ensuring that the menstrual cycle is being paid as sick pay, as a recognised condition, and that in line with that, endometriosis is being petitioned as a disability in itself.
Yeah.
I mean, that would be a good protective factor for the workplace. But exactly, sorry, it just made me think, what my dyslexic like that jumps in, is that if you're not diagnosed, you're not covered by all those protections.
Yeah, exactly.
And that's the point, isn't it? Is what happens to those conversations, which then loses that, being triggered for sickness. But it's that element that actually the psychological frustration is with the flexible working agreements, with remote working. That's not always going to be useful for those who work in front line. Or your clinical. you don't have the option. It's always dismissed. But again, if your health is impacting you being able to even function, that's such a frustration, because actually it's not your brain not being able to work, it's your body's given up. It's in that, it's almost like sabotaging your own career, isn't it?
Yeah, but also it forces, because women cannot say to their employer, I have X condition, because it's going to take so long to be diagnosed. You then can't ask for the support. You then feel that you are potentially going to be labelled as a bad employee. So what do? You then start to lie about things. You say, I need to take annual leave because of this. Sorry for the short notice. You go off sick with a cold or flu because you feel embarrassed about going off sick for this vague thing called pain again. So the way that people perform at work is adversely affected. The data that employers collect is adversely affected. The perception about somebody's abilities is adversely affected, because for a variety of reasons, they're not going to engage and connect in the right way in their day-to-day jobs. So this is a real perception penalty. We've got people who are going to be labelled as unreliable, emotional, and inconsistent. And that is especially the case for women holding junior roles.
Well, I'm trying not to be sounding so defeated, but it just constantly brings back to whatever topic we're talking about. I know we're talking about the women's health strategy here, but it's also around how much do we have to fight in our careers? We mentioned, obviously, previously menopause. We're talking about endometriosis and the health strategy today. We've had an episode on our experiences of that. But, women who's going on maternity leave, coming back from maternity leave, proving their worth, health. Now we're talking about, obviously, the physical and the psychological impact of having all of that. And as a leader, that is difficult to navigate, but it's a two-sided thing. We want people to be able to be open to talk about it so then they can get the support. But our same coin is the fact that they don't want it to be impacting their work and therefore their performance, and therefore going down a sick trigger and having to be performance managed.
Yeah.
So as a woman, it feels like, just hearing some of these things when you were talking, is there anything we don't have to battle against?
Yeah.
And actually, as women, and if you're a leader in any shape or form, I think we're all leaders in our own rights. It's just depending in the workplace whether you manage someone or not, is what are we doing to discuss this more openly, owning it, supporting and being advocates rather than judgmental, and just because we don't experience something doesn't mean it's not real for other women.
Yeah. I mean, the challenge of working through something that you can't explain,
or can't show.
Yeah. Or can't show. And also, how do you as a manager support team colleagues who perhaps haven't had a diagnosis yet? How do you support somebody with something that is unexplained and unexplainable, and then defend your position to your own line manager, where potentially you're being challenged for being too soft on that employee?
And that's the problem with data. It only tells you one story, doesn't it?
Yeah.
And I think we both talked about in our recent episodes, whether you talked about it in terms of your ADHD, I talked about it in terms of my neurodiverse. It sounds like strange, and then obviously my endo and health impacts. I definitely feel that I'm more confident now later in life.
Yeah.
Because I have more of I suppose, a confidence in having that label and understanding what stress is and how it impacts it. But it is, if you're a staff member or you're a leader or you're trying to work with colleagues and you see people in pain, I'm wondering how we can support people. Just, I suppose, what's our responsibility in the workplace? Is it to be curious? Is it to kind of ensure that our employees are aware that there is a women's health strategy to support women in maybe in ensuring that they get the right care, and ensuring that they've got a right to be able to get support, because actually we know that if you give a colleague the right support, they're more likely to stay. They're more likely to be, they're more likely to be flexible if you're flexible and have. I think my point is, it's not excusing the fact they're constantly going off sick and not performing, but it's about being curious about the reasons why.
Yes.
And enabling them to be safe enough to have the conversation without the fear of an impact to their careers or their progression or their development, for example.
I think it's about building a culture of trust where people are confident to bring all sorts of issues to one-to-one meetings and other discussions. It is about creating an environment of understanding, but equally, it's not to say that with that trust-based and curious and understanding focused culture, departmental or organization-wide, that as a line manager or as a leader, you are saying that it's okay for an employee to not work, to not perform. What you're saying is you understand the context for some of the challenges in working and in performing to the best of their ability at times because of X thing. So it's not giving somebody a pass for poor performance. It is being curious about factors in that individual's life that may impact them in the workplace.
So what would you say is, whose responsibility is then, would you say, around knowing as a strategy, knowing the fact of how to support someone? For example, if I have staff member come in to me to say they're really struggling and wanting, they're obviously undiagnosed or they've just got loads of health issues and I had no idea about it, would you say it's important for me to be able to understand what support there is out there, think about flexible working when those periods of times, and when we do one-to-one, we always do a well-being check. You're always thinking about what's working well, what's your challenges. So I'm curious about whether they're the opportunities
100,
for both people to have knowledge about it.
Because
it's not the leadership management position to know everything about every part of it. But I do think from what you're saying is that you're only going to build trust if you're able to have an empathetic ear.
If an employee comes to me with a challenge of undiagnosed pain that instinctively they feel might be endometriosis.
And not everything is stress related.
And not everything is stress related. So the first point is trust the individual as an intelligent female to say that this is the likely diagnosis, but build a position of trust so that that individual can come to you with that as a potential issue. Be curious and be informed as a line manager. So do some research to try and find out what is and isn't likely to be the impacts of an individual suffering from undiagnosed pain that may be endometriosis. And then work with the individual to set a good understanding of what can and cannot be achieved, what is and isn't realistic, and what could or could not be suggested as some reasonable adjustments. What I would say is that is exactly the same approach that you would use, that you should use, if somebody comes to you with some other health diagnosis. So whether that is stress, ME, some potentially life-changing condition such as a cancer diagnosis, anything, it doesn't have to be different or special because it hasn't been diagnosed yet. And that's where you get the same but different behaviour in good management and leadership, is that you individualise it, but a reasonable person objectively looking at how you've treated person A with an undiagnosed health condition that might be endometriosis, with person B who has a diagnosis of, let's say, ME, for example, where they are receiving medication, although the two conditions are different, you can still objectively see that there is a fairness and an equity in the way that they are being treated and of the management expectations that you have of each of them. And likewise, if we look at a third person who comes with depression, it should be the same objectively, but independently tailored to suit the needs of the employee, because the employee is not a clone of the one before and the one before that. They're individual.
But if you think about it, what you're saying is it should be equitable.
Mm.
But the problem with being equitable is that it's very difficult to see what that looks like anywhere.
Yes.
So if you're thinking about somebody who, we're talking about obviously this health strategy, the women's health strategies around endometriosis care, right? If you're going to something that you, when you're talking, made me think about is that person's experience before coming to that space is they've been potentially gaslighted, they've been silenced, they've had to fight their corner, being told it's normal, it's just, you just got really bad periods. All this language is constantly told to you as if you're the problem. And then you're going to have to then go again to be vulnerable with your manager to say, I'm struggling with having really chronic pain. I'm still not sure there's endometriosis, or if you have got it, that's part of it. It still feeds into the fact that they're not sure if that's going to be, it's that fear factor of, and the psychological impact of your workplace sometimes, for some people, can be the only place where you can feel that you can, I say mask, but don't have to talk about it.
Yeah.
And you can still, I suppose, escape that element, and you feel like you're achieving. And that fear factor of going, oh, not another person I'm going to have to open up to. And also specifically, if I say that word, if it's a woman you're having to talk to and they dismiss you, that's a really, really big challenge. And I think my one would be like, please let's not be those women.
Oh, 100%.
Let's be those women who are wanting to be advocates. We can't change those situations. Like you say, that whole be curious and working with and trying to be flexible within reason. Absolutely. But I think it's really important. It is everyone's responsibility, like everything. We're all coming with our own experiences, whether they're good or bad. And when you're coming to looking at this strategy, everyone's got their own experiences or opinions. So actually, when I'm reading it, I'm seeing it from different perspectives.
Yeah. As a line manager, and somebody comes to you with an explanation of undiagnosed pain, your primary responsibility is to be a decent human being. But equally, you should contract with that employee about what is shared, how much is shared, and with whom. That's part of creating a trust-based management and leadership relationship with your staff. I absolutely agree that there are challenges around having been gaslit by people in the medical profession, even family and friends. They can all present and can all shape how somebody sees themselves and how they perform in a role. There will be some female leaders, and we know that regrettably there are going to be quite a few male leaders who are not sympathetic when these issues are presented. But we need to be independently confident that if we are creating the right culture for women to present with these issues, eventually there will reach a tipping point where the people who are not supportive and empathetic are in the minority. And that may take a long time to happen, but it doesn't prevent us from shaping that to begin with.
No, absolutely. So I think if we just think about the strategy then, I mean, obviously there is some good points about it.
Yeah.
We don't want to be too much about, I suppose I'm coming from a different perspective where I'm like, that's great, but
yeah,
I do think obviously it does talk about pain standards, and I think that's really important, that it is overdue, that it needed reviewing because it wasn't moving quick enough. It does talk about joint up working, which I think is always, again, obvious. But the bit that interesting to read is really about the listening to women, which has been the bit that is really what's really missing that we've just talked about, is that we're not listened to in the way that we need to be heard. And so they've kind of put a funding link to it, which means that the feedback from us women in terms of care will then mean that the department or the departments that aren't working won't get funding.
Yeah. And that's the question, really. Is it as transformational as it purports to be? Is it just the same report, but just with some refreshed wording? One of the things when you were talking about funding as well, here's an interesting stat. We're going to put, as a country, £1 million for menstrual education across England. On the face of it, that sounds good. And then when you think about £1 million across the whole of the UK,
it's just it's sometimes on stats again are stats, but it's just a drop in the ocean.
Yeah.
And we keep hearing it everywhere. The NHS is underfunded. I always worry, I think I've spoken to you always outside of this, is that I always worry about language and how, it's a bit like if you're told you're broken enough times, you start believing you're broken.
Yeah.
If we keep saying the NHS is broken, we already know it's underfunded. We've known this for years, even before the pandemic, that there wasn't enough people, we're not being funded enough. So I always worry with this whole language around feedback, which is great, but the whole point around feedback, as we've done an episode on feedback, I think in our series 1, so obviously listen back to that, is feedback is about improvement, not being sanctioned against. And what they're saying here is if the feedback is bad, then we won't fund that department.
Yeah.
But we're already struggling to fund gynaecologists because we don't get to be seen. So
And
my fear of that, unless I've completely misinterpreted it, is it's great to be listened to, but if you're going to take the funding away down in 5 years' time, we're going to be even worse in a pothole. Do you know what I mean? And then the other element around the language is that if we need to start not keep saying the NHS is broken. We can say it's struggling, but we're working towards.
Yeah.
We want to see it moving forward, but using that language is almost like, oh, we might as well just give up on it then.
But also, if you're stopping funding, doesn't that increase the number of people who are going to be disadvantaged or who are not going to be helped?
And people are having to. I mean, at the moment, I don't know how many more people I am talking to on a weekly basis around people having to go to private healthcare to get seen and using money they don't have, get into debt in order to work through it. That concerns me. The impact of the strategy is great, but I always want to be able to see what the accountability is, what the actual plan looks like in terms of being broken up. If you're doing any project, as you know, if you're accountable to anyone, you would have to demonstrate of how you're going to get there.
Yeah.
You don't just go, this is what I'm going to do. You go, well, this is how we're going to do it. These are the quarters we're going to do it in. These are our bite-sized achievables. These are our, what they say,
metrics.
Quick wins and your metrics. What's your KPIs? All this language that we hear means absolutely nothing to the end user as the woman. So it's great they've included women are going to be listened more. The women's hubs are going to be useful. It's great that they're talking about how much menstrual education is going to be discussed. That still does not change. That's just awareness.
Yeah.
Do awareness every day.
Yeah.
Right? What we need is results. What we need is people to take on board and say, we've got it wrong.
Yeah.
That's how you build trust. If people kind of go, I'm sorry you haven't been listened to. This is what we're going to do, rather than constantly promising something with no clear plan. It feels like I'm attacking the strategy, but I'm just being realistic, I think.
No, but this is your lived experience as well.
I just don't want people to continue, I suppose, being dismissed, delayed, and deprioritised.
I mean, realistically, the impact isn't just health, as we've said before, it's careers, it's people's individual confidence and the performance that is adversely affected because of that. And equally, income and income generation.
I should have some hope about it. It does sound a little different.
But we have heard that before.
I think it's just fresh off the press. So I think there's lots of different elements. But I think what I'd be really interested is from our listeners is we've talked about it in terms of our experiences, but we'd love for you to tell us, has your health been affected of how you've been seen at work, or your experience of how you've been seen at work?
I think that's really key. It's great that the strategy has been reviewed and refreshed. It's great that it's getting, from my perspective, a level of publicity that it didn't have the first time. And I think that comes from some good work that has been done by this government around health and women's health in particular, by actually previous governments as well, and definitely by the amazing organisations that are specialising in supporting women with endometriosis, including with undiagnosed pain. And we'll put some links into these and the various resources that we have looked at and reviewed as we've done the work on this episode.
So I think the last thing to really reflect on is that if this has resonated, please send it to somebody that you know within your workplace. Let's be the women that don't just listen and leave, but listen and have some action. Let's empower, let's be able to be empathetic, because the chances are there's other women, as we've talked about it before, are managing more than we even realise. And one of those conditions would be endometriosis.
Completely. You may be a female manager managing other women, and you personally don't have endometriosis. But I would lay money on the fact that you know somebody who does. And they may have shared the fact that they've got endometriosis, diagnosed or undiagnosed, with you. But equally, there will be women who have not shared it. Those women are probably managing more than you realise.
So until next time,
keep your heels high and your standards higher.